And just a reminder of why we're talking about this. We're talking about this because in a mental health survey that we did a year ago, there were 5 top issues that the people in the congregation rose up as their main issues that are going on, and addiction and substance abuse was one of those. I will tell you that in my ministry, a week doesn't go by that there aren't 3 or 4 or 5 people that are coming into my office either with this issue themselves or that they are family members of someone that has some sort of addiction or substance abuse issue. And so I'm going to start us with prayer, and then I'm going to give us a little bit of a theological foundation, and then we're going to get started with the material. Would you join me in prayer? Lord, be amongst us tonight. Open our ears to the information that's going to be shared. Open our hearts to the stories of how you have worked in people's lives for wholeness and goodness and hope and health. We pray that you would be moving amongst us tonight, that if there are those in this room that need to find a new solution and to grab onto new hope, that we would be a place where that conversation could begin. Bless those that are going to present, give them peace and courage, and guide us, Lord, to the truth that will set us free. It's in Christ that we pray. Amen. Amen. So there are handouts in the back. We're not going to have a PowerPoint tonight. I think there are 2 handouts that you might want while we talk, and I'll walk through and make sure everybody has those in a few minutes. But, you know, why are we talking about this other than it's something that's going on with the people in our church? Well, we're talking about it because it's a place where there is brokenness in the people of God. And so wherever there's brokenness in the people of God, wherever there's pain, wherever there's dysfunction or discomfort, we believe that God is seeking to be in an active relationship, actively bringing people into health and wholeness. And so that's why we're talking about it. I'm going to introduce some folk to you in a minute, but well, let me just start there. Let me introduce to you our mental health initiative team. Guys, if you've been part of helping us get to this point, would you raise your hands? These are people in the congregation that are working in mental health. They're going to stick around afterwards, and they're going to be glad to visit with any of you that have questions. There's time built into our program at the very end for question and answer. So if you have a question that comes into your mind, write it down. We're not going to do conversation. I like to leave that to the very end to make sure our presenters have enough time to share what they want to share. So keep track of your questions. We'll have time at the end for question and answer, and there will also be time built in for you to have one-on-one interaction with people if you would rather not have your question addressed publicly. So there will be plenty of time for that if I stop talking now. And introduce to you a good friend of mine and a wonderful resource of wisdom and information on addiction and substance abuse and recovery. Kristen Davis is going to present for us. Kristen is a social worker, and she is connected with Starlight. I always want to say Starbright. Starlight Recovery Center in Comfort, Texas. And I'm just going to kick it off to Kristen to talk a little bit about this disease of addiction and how it progresses and what we can do about it. So, you have this.
Okay, great.
And I will go get your handouts, and when you're ready, I'll start handing them out, okay?
And you can hand it out now, Holly.
Okay.
I'll just refer to it a little bit. So it's really good to be here with you all today. Thanks for having me, Holly.
Raise your voice.
Yes. Okay, so before I get started, I just want to outline what I'll be covering this evening. I want to give you some basics about addiction, how it works in the brain, and how it progresses through several stages. And then I want to talk about the role the church can have in helping somebody on that pathway to dependence. I think the church can play a significant role in helping people before they get to that point of crisis in their addictions. So instead of going through a PowerPoint presentation, I did have the slides printed for you. There's a lot of helpful information in there. There's definitions, there's some facts and figures. But I wanted to take a more conversational approach with you tonight. And hopefully you'll get a chance to look through some of that information. And if you have questions, I'm happy to answer them during the Q&A. Or at the end, I'll stick around for a little bit. So let me give you a little background on myself. Like Holly mentioned, I got my master's in social work, and I've worked in and around the field of substance abuse and mental health for most of my career. Now, a lot of that was policy and planning. I did some mental health legislation at the Texas legislature, and then I did a lot of strategic planning with United Way for funding these kind of programs, community services. And so it was about 15 years ago, I had my first child, and I was looking for a part-time job, something I could do in the evenings and the weekends while my husband could watch my daughter. And a friend of mine said, well, why don't you apply for this job? I know they have openings. So I went to the agency and was prepared to submit my application and have an interview, and basically she handed me keys for the office and a cash bag and said, well, when can you start? And I found myself in a group of about 20 people. Now, these people had multiple DUIs. In some cases, they were manufacturing drugs, they were dealing drugs, they were certainly addicted to drugs, and they were required to be there as a provision of their parole or probation. Some of them were sent by CPS, some of them were in a jail diversion program, but they all had a lot riding on this, and I had no experience, and I had no curriculum. So I had to do a lot of my own research, and I did find a curriculum, and I loved that job. And I was there for about 5 years, and then I got my license to counsel, and so I moved into an outpatient treatment center. But I've never forgotten that job, and I met some wonderful people. So some people would say, well, they made their bed, now they can lie on it, right? I mean, we had people who had felony DUIs. They were driving with their kids in the car at the time of their arrest. There was just a couple vehicular homicides. So they had been driving a car and they were impaired and then hit another vehicle and somebody was killed. So these were some really awful stories. And it's easy to say, well, they made bad decisions, yes, but the question is, were they bad people? And what brain science is showing us is it's a lot more complex than that.
Kristen, I'm going to stop you there, and I want you to
Yes.
say that again. I want you to say what you just said one more time loudly. They made bad decisions.
Yes, they made bad decisions, but does that mean they're bad people? And what brain science is showing us is that that's a very complex question. And the answer is it's no, it's a brain disease. And I want to go over a little bit of how drugs and alcohol impact the brain, just to show you that there is an actual disease that takes root. And it takes over the person so that the addiction is now driving the behavior, not the person. So I'm not a neuroscientist, I'm going to rely a little bit on my notes here. I got this information from my husband, who went to an addiction medicine conference. So with the brain scan, you can see actual physical changes in the brain as a result of addiction, especially the part critical to judgment, decision-making, learning, and behavioral control. So that tells you a lot right there. It's a part of the brain that doesn't involve choice. So it's where things like your survival instinct lies. That part of the brain has been hijacked by addiction and now feels like you actually need the drug to survive. And that's what you find is a lot of people say, well, we're not using to get high anymore, we're using to feel normal. We're using to avoid the pain, and we're using to survive. So good people will make bad decisions. They'll lie, they'll cheat, they'll steal because they feel like continued use is a matter of survival. That was kind of the tragic part of working with minors, because they still use. So they might have lost spouses, they lost jobs, they lost custody of their kids, they lost their freedom in jail and prison, they had poor health, things were deteriorating rapidly, and they couldn't stop using. This doesn't make any sense, it's not rational on any level. So until I started to understand these things, I really didn't get that it wasn't a choice, that it wasn't something they could just stop if they wanted to. And that takes some of the stigma out of it. And I think if we can reduce the stigma, then we can encourage more people to come forward and get help before it becomes a crisis. So the good news is that the majority of the brain will heal itself. It's called neuroplasticity, and it accounts for the significant changes in the brain in the first 3 months following sobriety. This is a very critical period of recovery, and it's why AA often says do 90 meetings in 90 days. Because it helps, that's the part at which the brain recognizes new behavior, basically, and it kind of cements it as a habit. So that's what happened with my brother. My brother went to 90 meetings in 90 days about 10 years ago. He had started, abusing substances when he was 13. He started with alcohol, and then he started smoking marijuana, and then he was using cocaine. And for about 10 years, his use just continued to escalate, and then he was getting head injuries with bar fights, and then he was getting bleeding ulcers, and he was going to the hospital, and we didn't know. I was probably 18 by the time he had started using. So I wasn't in the home, but I considered myself close with my brother. And it wasn't until he was about 25 that he came clean and told us that there was a problem and he needed help. So he went to his 90 meetings in 90 days, and that was 10 years ago, and he's been sober ever since. And his life looks completely different now than it did then. Gerald May, who's written my favorite book on addiction, I brought it tonight. It's Addiction and Grace, and it talks about addiction from a neurobiological, a theological, and a psychological viewpoint, and it's the best book on addiction I've ever read. Gerald May says, to be alive is to be addicted, and to be alive and addicted is to stand in need of grace. In it, he defines addiction as a state of compulsion, obsession, and preoccupation that enslaves a person's will and desire. He says that some of his addictions are to nicotine, caffeine, sugar and chocolate, work, performance, responsibility, intimacy, being liked, and being helping others. I've listed some behavioral addictions in your packet, and I hope you'll take a look at those. I think as you get in touch with some of your own addictions, it helps you to relate to others, even if there's a difference. So what causes addiction? Where does it begin? So I think it's page 3 of your packets. There's 4 things in there that have been identified as possible risk factors or root causes of addiction. One is that it's genetic. I'm just going to touch on 2 of them. So say you have 2 people, and one has the genetic predisposition for addiction and one doesn't. You put them in the same environment, they use the same amount of substances, they start at the same time, one's going to have his disposition activated or expressed, and one's not. One's going to go on to kind of age out. They'll get a mortgage, they'll get a job, they can't keep using to maintain those things. Well, one person is going to, it's like a switch that's flipped in their head, and once it's on, it's hard to turn off. So this person will progress through the stages of addiction that I'll talk about in just a minute. Dopamine's the other thing I want to talk about. Dopamine is that feel-good molecule. And you know what it is if you've ever had a piece of chocolate cake. It's the boost that you get.
Dopamine.
It's that feel-good molecule. So I just want to give you a point of reference. So food gives you about 150% boost in dopamine. Sex gives you about 175%. Alcohol gives you about a 300% boost in dopamine. And by the time you're talking about amphetamines, like cocaine, methamphetamine, you're talking about 1,000% boost. So you can see how this really burns out your pleasure center. After you've done things like this, nothing is pleasurable anymore. So that does heal over time, but it's the kind of thing that you can understand how relapse happens and how someone gets addicted when you're talking about immediate gratification. Because what people say, the number one reason they give for quitting their drinking or using behavior is that other people want me to. And compare that to the immediate hit of dopamine they get when they're using, and there's kind of into that irrational equation, it starts to make sense. So I also put in there, not just, we're going to be talking about alcohol, but I put other substances of abuse, and I know you guys know the opioid epidemic. It's awful in our facility that I work in. We see a lot of heroin, pain pills, morphine. It's a plague. And an interesting statistic I read is that in 2012, there were 259 million prescriptions written for pain pills. That's enough for every American to have a bottle of pills. So it's a blight on our society. So I want to spend just a few minutes on page 5, which I believe is the one right after the list of substances.
And if you didn't get a handout, I will have them available next time. Maybe share with whoever you're next to. I think we've run out of them.
It's called the stages. I believe it's called the stages of use.
There's 2 more if you need one.
It's the pathway to dependence. So I'm just going to illustrate illustrate on the board what I hope is a helpful description of some of the process or the progression that people go through on their way to addiction. So this is level of consumption, so how much someone is drinking or using. And this is loss of control and level of impairment. Okay, so you start out, and this isn't working great.
No, I can barely read it.
Yeah, I'm sorry. So we've got level of consumption and loss of control and level of impairment. So you started here with use. And this is a minimal or moderate level of use. And so since we're talking about prescriptions, let's just use the example of a prescription drug. So here you're using it as it was intended to be used. As you work up to misuse, meaning you're using it for an purpose it wasn't intended for. So now instead of treating, say, your pain, you're now coping with marital problems, depression, anxiety. You're using the relief that you're getting from the pain pill to treat other problems. Instead of getting to that root cause of that problem, you're self-medicating, basically. So as that progresses, you're going to be to abuse. And I just want to say here that you're still disease-free. You still have a measure of control, but you're starting to experience some of what we call negative consequences. So you go up into abuse, and this is when things start falling apart. You might lose your job, you're impaired on the job, you've got problems at home, your spouse may leave you, she may take the kids, you start having health problems, your doctor tells you you need to stop, but you continue to use. So continued use in spite of negative consequences is what we say is kind of the hallmark of abuse, substance abuse. And if you keep going, you're going to hit substance dependence. Now this is the area, what we look at are three things. So tolerance, withdrawal, and loss of control. So this is when things have gotten about as bad as they're going to get. And let me just make sure I'm not missing anything. So really you start out using pleasure here. You start out for pleasure, and then you end up using to avoid pain. That's what happens as you move through this cycle. And again, some people are not going to have any control from the beginning. We talked about it like a switch being flipped. For some people, that's going to be from the first time of use. It's almost like innate tolerance, like they drank differently from the very beginning here. So they're going to progress really quickly to dependence. So even once your progression has gone all the way to dependence, you can still halt some of the behavior there. And I'm put on one of the pages, I think it's the next one, there's a progression from an early stage, a middle stage, and a late stage of addiction. So you can halt it, but you can't cure it. And I want to make sure I emphasize that point, that there's a difference between it being treatable and being curable. So symptoms can go into remission, but there's always the risk of relapse. And that's why you'll hear somebody say, well, you know, I was drinking however much here, and when I relapsed, I might have been clean for 5 years, but when I relapsed, I went right back into drinking that same amount. Your brain, you've basically been in remission from your symptoms. So this is the deeply troubling part of it to me, is that a lot of times we won't see people until we're here. It's almost like they have to reach a crisis before they reach out for help. And so that is where I think the church comes in, where we can provide early intervention to people who realize that they have a problem. They know that things are getting out of hand. They know they need help, but they haven't asked for it yet. And I think we do that by creating safe, judgment-free places for people to be able to come in and say, I think I have a problem. And maybe they want to explore that. But that's the question, is was there a place for them to go? Was there a person for them to talk to? Were there any open doors? People who said, you know, let's talk about that together. Let's look at that. I have a suspicion that churches don't have many open doors for people, that we've too often moralized this problem, and we kind of demonize the people who struggle with it, so they don't feel welcome. in churches when they have so much of this going on.
Which, Krista, I'm going to just interrupt real quick. Part of this shift for us is seeing that this is a disease. This isn't a moral failure. This isn't about someone that has weak will. This isn't about someone being a bad person. This is a disease. Now, bad decisions are a whole other thing, but this is a disease, and that's part of where the church has an opportunity to really shed some light and do better than we've done before.
Right.
Okay, I'll stand back now.
And no, in that book, Addiction and Grace, really lays that out. If you're more interested in some of the brain science behind it, he does a great job explaining that. So I want to just make a quick comment. What I think is part of offering a safe and judgment-free place is accepting them where they are. And for a lot of people, that's going to mean that they're ambivalent about changing, and they might be resistant to changing. And those are two very normal parts of the change process. So I'll just tell you, when I started facilitating groups, I had a colleague, and she had been doing it for a while, so I went to see how it was done, and I learned how it's not done, which was probably just as beneficial. We were in a group of about 20 people, and she was trying to get someone to admit that they were an alcoholic. He had multiple DUIs. Undoubtedly, his life was coming apart. But she shamed him. She humiliated him, and he got defensive. And from what I could see, is he was set back so far in admitting he had a problem because he was arguing with her. And the more he argued with her, the more deeply entrenched that he became in his belief that he did not have a problem. So unless somebody self-identifies as an alcoholic or an addict, I do not put that label on them. If they have a problem with alcohol and they want to stop, or they want to explore the idea of stopping, I think that's really all that's all you need. That's a good starting point. So what I want to spend the remainder of my time talking about is some of the spiritual, mental, and emotional effects of addiction and how the church is uniquely situated to help. So I have that. There's a lot of information here, but I wanted to just jump ahead. Let's see, and it is maybe kind of midway through. So it's spiritual, mental, and emotional effects. It's about halfway through your packet. So you can see, sorry, I've lost my place. So you can see here some of the devastating emotional effects of drug use. And before I do that, actually, I want to go back to this first one. So it says, addiction is characterized by a loss of interest in life, feelings of guilt and self-resentment, and anger towards self, others, and God. And this is where the church can really step in. We can help them understand the fundamental meaning of life. We can help them reshape how they think about God. In my opinion, we've all cast God in our own image. We all think that He thinks about us the way that we think about ourselves. And we have to remind people that they're deeply known and they're deeply loved by God. Some churches have not communicated that message very well. And so somebody might go and experience church as a place of judgment and not compassion. So they're going to be slow to trust. And that might mean they're slow to reveal to you the extent of their problem, all their losses, and the mistakes that they've made. So we need to earn that trust. And we do that by assuring them that they're in a safe place. So just as an aside, I think generally my approach is that people are doing the best that they can with the hand that they've been dealt. And some of it's really tragic. You see a lot of people coming in with physical, mental, emotional, and sexual abuse. We see that a lot in the facility I work in. They've had devastating losses. They struggle with crippling depression or despair. They feel a profound amount of loneliness and emptiness. So we don't know what somebody's been through. And so that's part of creating a judgment-free place, is sort of suspending judgment about their behavior because we don't understand really their background. So you can see some of the emotional effects there. And the one I want to focus on is shame, because I really don't think you can understand addiction without understanding the nature of shame. So I brought a book that I really like. Again, he's not a neurobiologist, but he talks about it a lot from the perspective of the brain. It's called The Soul of Shame. And in it he says, shame is the felt experience of deep inadequacy. He says the most precise definition is the painfully acute feeling that something is wrong with me. And I think we can all relate to that in a way. I don't care how you look on the outside or, you know, what image you try to project to people. We all have those parts of ourselves that we feel are inadequate or that we have to hide. So what you have to understand is that shame is what keeps us from reaching out and forming relationships. And the absence of relationships will actually create an emotional bond with a substance or a behavior, an addictive behavior. We're going to fill that vacuum with something. So addiction, one of my favorite quotes about it is that it's a failure of intimacy. So the church can step in and be that companion, be that community, be that sense of connection for somebody. And that really quickly takes the place of that emptiness and the loneliness that they've been feeling. Those are major triggers for relapse. So when you're dealing with somebody who's got an emotional bond with a substance or a behavior, taking that bond, breaking that bond, you're going to feel some grief and you're going to feel some loss. And so that's also a real part of getting clean. So the question that brought all of you here today is, what can I do to help? How can I make a difference? And I knew I was going to run out of time, so I put what I thought are the most important aspects of working with somebody on a piece of paper. There's 10 suggestions that I have for working with somebody. Really in any helping relationship, whether they have mental health or substance abuse problems.
It's an individual page, it's not in that package, it's another page, one sheet, that kind of put on your paper.
Yeah.
If you need one, raise your hand, I'll give you one.
So I'll just say,
We need one up here.
Okay, keep going, Kristen.
okay, so I'll just say in closing, some people may not go to a professional or a treatment center, but they may knock on the door of their pastor. And so that's a huge opportunity for us in the church to minister to somebody who's maybe just telling their secret for the first time. Don't let them leave without a sense of hope that help is available. We can be their safety net. This is a chance for us to have a significant impact on their lives, not just their life, but their whole family. This can be a real turning point for them. This happened to me in college. So I was having some pretty significant problems, and I was kind of reaching a crisis myself. And I went next door to the Episcopal church, and I asked for help. And the pastor there paid for me to go to a doctor, and she set me up with a Stephen minister. And it was so impactful to me that 25 years later, I remember her name and I remember her face. Because that was the first time I'd ever gotten really honest about what was happening in my life. So you really can. You can make such a profound difference in somebody who's just starting to explore some of these problems and feelings. There's an expression that we're only as sick as our secrets. And so being a safe place for someone means that they're going to probably tell you some pretty troubling things. And just remember, you don't have to have the answers. You just need to be someone there for support. Just the assurance that they're not alone in that is often enough. So I just think in terms of the church and the role that the church can play is just affirming somebody's intrinsic worth and value, no matter what they've done, no matter where they've come from. And being able to just bring them into the faith community as they are and just remind them of their value to us and to God. So that is my information. If you have any questions, I'm happy to stay afterwards and answer them.
Thank you, Kristen. So I'm thankful for Kristen's sharing, and I'll just lift up a few things that I think can't be said enough, especially in the church. Addiction is a disease. If there's someone in your life that's using or in a place of misuse or abuse or addiction, they are beloved children of God, and we have a role in loving them as part of the body of Christ. So it's easy to imagine when you think of someone who's addicted. What do you think of? A lot of us think of the bum under the bridge, right, with the brown bag. Part of what tonight I think the real power is to put a face on addiction that looks like people that sit next to you every Sunday. People that are in your Sunday school classes. People that are vital, vibrant, active participants in the life of our church. And so tonight I've asked two people who are part of our church to share their story of addiction and recovery. And they're just going to give them a talk and tell their story. I don't want to give them plenty of time to do that. I wanted a male and a female. And then at the end, I've got a few other things I'm going to say about families. And that it's a family disease and how that impacts the family. But as we've done every night, we've had a testimony. I'm going to invite you to start now in a time of prayer, and I will say, the Lord be with you, and you respond also with me. Let's set the stage for our speakers. The Lord be with you.
And also with you.
Open our hearts to hear the words of these brave people, Lord, and use their testimony to show us the truth. In Christ we pray. Amen.
Amen.
Who's going to go first? America. America Wilson has agreed to give her testimony. So here you go, America. I think you've got about 10 minutes, so I'll just kind of wave my hand when we're
I brought my,
close.
look, I brought my technology
There
too.
you go.
Here we go. So, hi. I'm America, and I am an alcoholic. And
Hi, America. Hi, America.
Thank you. That was the kind of welcome I was
Yeah.
expecting. My sobriety date is September 8th, 2016, and for that I am grateful. Saturday, I spent with both my sponsor and my grand sponsor. My grand sponsor was celebrating 28 years of sobriety, and my sponsor and I both have, we all kind of have birthdays around the same time. It's kind of strange now that I think about it. And my sponsor just celebrated 10 years. And so there we all were together, community. You know, you always hear that the opposite of addiction is connection. And so the three of us were sitting down and we're breaking bread Saturday night. And it was just a really great evening. It was just joyous. And these are my people. These are like my sisters. And I go home and my husband's watching TV. He had put the kids in bed and he's watching Star Wars. And I am one of those strange people that have never seen an entire Star Wars movie from beginning to end. Never seen any of them. So there he is, and I sit down on the couch with him, and I've watched 5 minutes, and it's Yoda, and they're in some sort of swamp, and Luke Skywalker is trying to raise with the power of whatever, you know, the ship out of the swamp, and he just couldn't do it. And all of a sudden, Yoda says to Luke, what does he say? It's something, it was very simple, but it's very powerful. He says something like, do or do not. There is no try. And I look at my husband, I go, there it is. I knew it. Yoda's in AA. That's where he gets all of this like wisdom from and all the mindfulness and like Yoda is totally in recovery and nobody's ever known it. Like they never read the movies. So, you know, when I entered recovery, the thing that I had the hardest time with was that I didn't fit my own definition of an alcoholic. Because my whole life, you know, you're like that guy in the van down by the river, you know. That's who the alcoholic was, not me. I was living in a nice house with a husband and like 2 beautiful babies, and I'd had a successful career in publishing before I became a stay-at-home mom, and there I was struggling. So I'm going to read to you just these 2 paragraphs. So the big book of Alcoholics Anonymous, 90% of the book is actually these stories. And the stories in the back of the book are broken up in 3 stages. And they're the stories of people in different various levels of I guess, the disease. So I read this, and it changed my life. This right here, this page is what basically said to me, aha, I got it, I see it. And it says, they stopped in time. Among today's incoming AA members, many have never reached the advanced stages of alcoholism, though given time, all might have. Most of these fortunate ones have had little or no acquaintance with delirium, with hospitals, asylums, and jails. Some were drinking heavily, and there had been occasional serious episodes, but with many, drinking had been little more than a sometimes uncontrollable nuisance. Seldom had any of these lost either health, business, family, or friends. When do men and women like these join AA? The 17 who now tell their experiences answer that question. They saw that they had become actual or potential alcoholics, even though no serious harm had yet been done. They realized that repeat lack of drinking control, when they really wanted control, was the fatal symptom that spelled problem drinking. This, plus mounting emotional disturbances, convinced them that impulsive alcoholism already had them, that complete ruin would only be a question of time. And seeing this danger, they came to AA. They realized that in the end, alcoholism could be as mortal as cancer. Certainly, no sane man would wait for a malignant growth to become fatal before seeking help. Therefore, these 17 AAs and hundreds of thousands like them have been saved years of infinite suffering. They sum it up something like this: we didn't wait to hit bottom because, thank God, we could see the bottom. Actually, the bottom came up and hit us. And that sold us on Alcoholics Anonymous. That page saved my life. Because up until that point, I was like, well, I'm just a little problem drinker, Well, why won't these kids just go to bed so I can have my wine? And relax because I've been working really hard all day and I deserve it. And the reality of it was that I was dead inside. My marriage was falling apart. I wasn't parenting my children the way I wanted to. I was alone. I started to just break away from community. It got to the point where I was not even making play dates with my children anymore, because every rule I had ever made for myself when it came to alcohol in my home, because I wasn't in a bar. I was in my pantry, drinking from a coffee mug. Every rule I had ever made for myself that I won't do this. Okay, well, maybe I got drunk last night and I can't remember what happened because, or didn't remember the argument with my husband was because it was red wine. So I just won't drink red wine anymore. I'll just stick with white. Well, maybe it's just the wine. It's too much sugar. It's messing with me. I don't know. Maybe just, like clear liquor. And, it's like all these rules that I would just make for myself over and over and over again. And to say that my life was unmanageable is a gross understatement. I was on my way, and it was going to be ugly. And one day I just decided, I was getting in my car and I was going to Costco to go buy just ridiculous more amounts of alcohol. And instead I decided to look at my phone for an AA meeting. And I walked in straight into the arms of a complete stranger, and I never left. Part of my story is, yes, I got sober. I walked in through the doors of AA and I got sober. But then, you know what? Surprisingly, things just didn't become peachy dory anymore, like out of the blue. All of a sudden, my marital problems were still there. I was still very annoyed with my children. And I had to dig deep and figure out what it was that was happening in my life. I was working the steps. I had sponsorship. I had a wonderful sponsor. We were doing the step work. I was doing inventory. I was doing all of these things. And a friend of mine suggested that I try another 12-step group. And this is something that we've been talking about all these weeks, is that, a lot of us are not just one thing. A lot of us, and the places that we have landed in, are because of underlying issues. So many of them have coming up from our childhood. And that other 12-step program that I walked into was ACOA, which is Adult Children of Alcoholics and Family Dysfunction. And then I started doing that step work. And let me tell you, the generational dysfunction in my family that had brought me to my knees is real. And it goes deep, 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 deep. And I've had to do incredible hard work and things coming up that I had just completely forgotten about. Years of my life, especially in my high school years, just completely gone. Where I specifically remember being at school, subjects, friends, all of this stuff, but talking about my home life, I couldn't tell you. I couldn't tell you what my home life was like until I started doing a lot of this research of my own life and talking to my mother about her family. I am the daughter of an alcoholic. My father is an alcoholic. My mother is the daughter of an alcoholic. Alcoholism is real, and it runs deep and is generational in our family. And so it really, I implore you that if you're feeling alone tonight, you are not. I was right here in this church 2 years ago when I entered sobriety, and I didn't ask for help. I didn't go into the offices. You know, at the time, I know Pastor Holly and Pastor Ben were rather new, but I had a relationship with Pastor Lorinda, and I love her very much. I loved her from the moment I met her. But that's not something that I felt comfortable doing, because one of the things that had happened to me in my childhood was religion had been used to harm me in horrible ways. And so here I was, trying to have any kind of a relationship with God. And I was really afraid that opening myself up in the church was only going to label me, and it was going to shame me. You know, and the shame of all the things that had been going on in my life behind closed doors really came out, and I just couldn't do it. It wasn't even until I hit a year of sobriety that I found out I had another dear friend right here in the church who had had more than 10 years of sobriety. And we just weren't talking about it. We weren't talking about these things in our women's group. We weren't talking about these things in our MOPS group of mothers with babies. I mean, and my goodness. So a couple of months ago, I went to Pastor Holly, and I requested a meeting with her. You know, I also sponsor women at this point in my sobriety, and it was a good time. I found myself sponsee-free for a moment. The last one I'd had moved away for a fabulous job she got. And I said, you know what, well, my hands are clean and free right now. Let me reach out to Pastor Holly and tell her my story, and tell her that I'm here if she ever needs me, or ever needs me to go and sit with someone in our community, in our church. And so that's how I ended up here. So it's taken a lot of work to get here, but I'm really thankful, and I'm part of this church, and I'm not going anywhere.
There you go. There you go. Thank you, America. I want to introduce to you another friend and co-church member and wonderful, beloved child of God, Dave.
Hi,
Hey.
I'm David T. I'm an alcoholic.
Hey, David.
Hi,
David.
Wow, America. So America and I met 30 minutes ago. My sobriety date is February 1st, 2016. That's about 2.5 years ago. That's about the time I walked into this church. There's a lot of similarity there, and I'm not going anywhere. If you recognize me, you might be from Bernie. Or you might have attended one of the special services here at this church, including a funeral service that was about a month ago for somebody that had died because of addiction. And I'm close friends with his dad, and that's a tough story. And Holly spoke at that funeral, and I introduced myself to Holly after I heard her talk, and that's how I got here today. I joined the church with my family about 2 months ago. Had been working here for too long, and we're very involved in the special needs service at 11 o'clock. So if you want to find me and you don't find me right after this meeting, you can find me here at the church, either at 9:30 listening to Lorinda, or 11 o'clock at special needs. And that ministry is probably moving over here in the next few weeks, so we'll be in this building, which is really cool. I play the tambourine and I sing. And we have tambourines to share. You have already heard this story about people don't look like the bum under the bridge. Up until I found myself in recovery, the closest I had got to that was being part of a church group and being in men's ministry and serving people under the bridge. And what happened is I started drinking in college, mostly binge drinking. I walked this scale over a long period of time. I'm 55 years old today. Well, not today.
Well, whenever it
We can all
was.
sing, right? So, but it took me a long time for the drinking to get so out of control that it was affecting not only me, but my family, and that I had become into a really serious denial situation where I was promising to myself and to my family that I would stop drinking, and then showing up the next day with a cooler of beer in my car because I knew I was going to get in trouble for having it in the house, so I was carrying it around in my car. I wound up taking a very long business trip, and when I got home, my wife was no longer there. That put me in a situation where I was disconnected, which just put me off the chart. I was by myself, disconnected, free to drink, and I drank heavily, and wound up in several situations where I was talking to people who were also drinkers, and for the most part, I would say walking into a bar and talking to a stranger is not the way to find yourself a recovery program. Right? But if you really are serious about recovery, find somebody who used to be a drinker. And I got introduced to somebody like that, whose wife was in a recovery program. I started to get interested in seeing if I could find my way out of this, and I wound up at a program called Right Step, which is a rehab outpatient program. It's on Blanco Road over near Churchill High School. And then I walked into my office several days later and asked to come in late for the next 8 weeks, and was drug tested for the next 8 weeks, and I needed that forced program. I could not do it on my own. I had promised and promised and promised, but it didn't happen. They made sure that I wasn't drinking, and they made sure that I checked into some recovery meetings. If you're looking for a meeting, grab that handout. There's some great meetings at this church. If you're looking for an AA meeting, come to my home group meeting. It's at Coker United Methodist on Tuesday nights at 7 p.m. You can exit off of Wurzbach Parkway into the Wellness Center. And I've been there for 2.5 years and not looked back. And I found this sponsor there. I'm on step 10 right now. I got stuck for a long time because I did not have a sponsor. Don't let that word scare you. Just find somebody that has experience with being in recovery, or has not had a drink for at least a 24-hour period, and talk to them about that. Don't do it on your own, is what I'm trying to say. You might be an alcoholic, and there are many other addictions, so think through that. If you need to have a drink every day, and even if you quit, if somebody were to tell you they're going to ask you to not have a drink in the next 24 hours after that, that would make you feel uncomfortable. That's kind of where I found myself. That was my gut check. Another meeting that I'd like to mention is at Alamo Heights United Methodist on Friday night at 7 p.m. It's called Pioneer Group. And it's not an AA meeting. It's an open meeting for all of the addictions, all of the 12-step programs. And it's a Bible study at the same time. So that's a very unique meeting. For the most part, AA says you can find a God of your own understanding. So it fits really well with us. But not everybody in those meetings would be a fit for a Bible study, if you're following me. And I wanted to mention that because I got disconnected not only from my family and from my life, but from God. And that caused me to drink more. It wasn't God that caused me to drink more. It was me that moved away. And I think I'm starting to find my way back, and being grounded in this church gave me the courage to walk up to a pastor I hadn't met yet and tell my story, which then turned into a cup of coffee, which turned into me being here. And that's all good. I feel good about being here because I could be somewhere else. And you all know where that would be. So thanks for letting me share.
Okay, so I'm going to talk just a few minutes about being a family member of someone that has an addiction. It can be a parent, it can be a sibling, it can be a spouse, it can be a grandparent. Alcoholism and addiction is a family disease, and Chris can talk way more about that than I can from a, well, you can talk about it in lots of ways. I can tell you that for me, and you, most of you heard our story of my family and addiction when I preached a few weeks ago. Finding a 12-step program of recovery for family members is as important, if not more, than the addict finding their help. So my wonderful husband is over there running the camera, and I adore him and love him, and he's an alcoholic in recovery. Yeah, you should clap for him. That's good. And our story is one that he got sober quick. He got into he wanted help. Our story is not normal at all. He wanted help right away, got help, got better fast. But as he got better, I got worse. I got really worse. And our story involves one day after going to an outpatient treatment program on a Saturday that we went to as part of his recovery. I completely lost my mind at a Sweet Tomatoes restaurant off of 249 in Tomball, and we were sitting in the parking lot in the rain, and he looked at me and he said, "I'm good, but if you don't get help, I'm going to live in a halfway house or a sober living house. I can't live with you unless you get help." My disease of needing to make everything okay and fix everything was impacting our life more than his drinking ever did. And so I share that today to just let you know that if you love someone that has an addiction, you have work to do too. Even if it's not an active addiction. I lose my sanity every week unless I get my tail into a meeting. Because that's my disease of needing to control and make everything okay. Al-Anons have our own diseases. So that's my story, and I'm glad to visit with you more about that afterwards. I want to get us to a place of asking questions, but before I do that, I need to talk a little bit about what I've seen in rooms of treatment centers and in rooms of 12-step meetings and rooms where people are finding recovery. And what I've seen is resurrection. Plain and simple. I've seen it happen in my beloved husband. I've seen it happen in me. I've seen it in my friends that are around these tables. This disease will kill you. Even if you're not the addict, it will kill you. And what I've seen through recovery, in whatever way you find it, is that people that are on the brink of death get reshaped and remade and find life in abundance. I mean, did you hear the people who talked here tonight? They have life in abundance after being at a place where they weren't sure. And so all that is to say is that I see our faith and our God in the most powerful ways through people that have the honesty to talk about addiction and recovery, to be honest, to not be bound by shame. And the church has a real role in that. And so my heart broke as we moved through our family dealing with this. My heart broke that I was seeing resurrection in treatment centers. And I wasn't seeing it in the church that I served. So that's one reason why we're doing something like this tonight, to talk about it and share it. And so we believe in a God of new beginnings. We believe in a God that can take everything and make it new. I'm standing here because that happened in my life. I don't want to speak for you, but I think that's true for you too. It's true, I think, for America and Dave and Kristen and her family and many others in this room that you don't have to identify yourself. Let me stop now and invite you if you have any questions to ask in the large group, and then we're going to break down for if you want to have one-on-ones. But any questions, comments, concerns that you want to ask the crowd? Yeah. Mundo.
Oh, that's good.
Okay, sorry.
I have one comment first, and then I'll ask
Okay.
a question. One comment is that I've been in this church for 3 months now, and I regularly attend Cornerstone, and I do that because I love the message that they give you there, because it's a message of accountability. But it was too huge for me, so I went around looking all over the place for smaller churches. And the only, and I met with Pastor Howard, and I told him the truth. I said, the only reason I'm here is because my car broke down. I live a half a mile away from the road. And I really didn't like the message until you gave your message. And then the accountability week after that started coming in. And so it seems like a common thread here that you are a gift to this church. Thank you. The question is to you. If you know a family friend or a family person that has struggled with drug addiction, okay, and you put them into this stuff and they somehow quit, they found a reason to quit, but you're still not sure that you've actually done it, because we know this is where you hone in that line, because you don't know what they do, and they're really good at being functional, what we'll call functional addicts. How do you recognize that that's happening?
I mean, I don't know that I can speak to that as well as
From your experience.
somebody who's been there. I mean, I know at our treatment center, we have a family education program, because that really helps, I think, families to get an understanding of what addiction is, what it looks like, what can happen in the course of recovery. But in terms of being able to trust somebody who's maybe betrayed you in the past, I mean, I think that's work that you have to do.
Yeah. I mean, short of going through all the drawers and stuff like that every single day.
That's where an Al-Anon program has been really helpful in my
And
life.
I'm going down
Yeah.
on programs.
That, shifting the view from worrying about what my loved one's doing to trusting a God more than I distrust or fear.
Yeah, I
Hear
knew nothing
that.
about Al-Anon, so God led me to an Al-Anon meeting every week since then. I love it. It shows you just how vastly it's affected you and how to let go of the guilt.
Yeah. I think what you're lifting up, Mundo, is the pervasive nature of the disease, that it will find a way to grab you.
Yeah, and I think I
And
want to make a comment
contort.
about that. My version of disease is a cancer. It's killing you. Obviously, it's treatable. You do radiation. You do this. Alcoholism is something that we think of as when you brought it onto yourself, and I never really thought about it as a disease, that all of a sudden it just changes and it took over you, and it has real physical and medical things that takes a while to get over.
Yeah.
And
Yeah.
so it's something I never realized until about less than a month ago.
Disease.
So I think that if you look in your handout, the 11 criteria is a really good list, if you read a list. But what I would say is you might be a functional alcoholic if you're on your own and there's nobody else in your life. But as soon as you start to impact other people, I was a functional alcoholic when I went to Chili's and had a couple of drinks and drove myself home. But when I put my daughter in the car, I was crossing the line. And so you start to cross more and more lines and check more and more of these boxes, and then you need to probably ask somebody else to see if they want to join you in that conversation. You won't be able to diagnose yourself.
Yeah. What about when they're 18 and 19 and you no longer have legal custody of them, but they don't want to recognize them, but you said you gotta let them go. But they're so young, you know that you're gonna hit bottom and it's gonna go to jail and it's gonna ruin the rest of their lives. You want to control.
That's where a program for the family is just vital. It's a hard answer, but there's a solution there for you.
My son is bipolar, he was diagnosed when he was 18, he's 23 now, but I dropped 12 pounds and I just got lost. It was devastating. But the only thing that saved me was I went to NAMI, it was a 12-week course at CDC, and they went through the brain changes, they went through what to do, what not to do, how to do things, but I think if I had not gone to that program, I mean, I was, you know, my husband goes, I didn't sign up for this, and it was devastating.
What was it?
He's like.
No, the program at Easy.
It's non.
And there's some information on the back table about that.
Free courses, you meet once a week, 4 hours, free lunch.
There's some information in the
Other
back
people
about
that
that.
have the same, you know, siblings, you know, it really, I was really going downhill, trying to cope with all of that.
So the commonality there is community. You can't do it on your own, right? You can't do it on your own. You got to figure out something, whether it's a 12-step program or sitting with a pastor or seeing a counselor, find something that gets you into community where you're not trying to solve it alone.
I met parents, siblings, grandparents, and they all had somebody that had a mental illness diagnosis, and we all learned how to cope and how to not be sucked into being the victim. I mean, because bipolar is extremely smart. It's very manipulative. So, I mean, you have to learn to make boundaries even though they're mentally ill. For me, it was super hard. It was super hard to, I knew my son was sick, and he was threatening to kill himself, so it was extremely hard for me not to give in to it.
Which I think is a little, I think, celebrate recovery of any kind. And you're willing to raise your hand tonight because you'd invite somebody to come talk to you if they want to, I'd invite you to raise your hand. Let's pray. Lord, use our conversation and our time tonight in a way that would honor you, in a way that would lead others to life and life abundantly. Thank you for the healing in Dave and America's life. Thank you for the healing in Kristen's brother's life and in her life. Thank you for the healing in my life and in the life of my husband. Thank you for the way that you really can make all things new. Help us be a church that can lead others to the source and the strength of your love that we know in Jesus Christ. It's in his name that we pray. Amen.